Hello everyone, I'm Riley King and welcome to your special report, Drug Czar, role extended into next year. A key commission aimed at tracking the state's growing drug abuse problem voted Friday to keep paying a drug czar, even as criticized questioned whether the state will get its money's worth. A grant from New Hampshire Charitable Foundation is paying for the first year's salary for Jack Wozmak, formerly known as the governor's senior director of substance abuse and behavioral health. The position is designed to coordinate the state's efforts around substance abuse and mental health treatment and preventing members of the governor's and drug abuse prevention, treatment, and recovery database. Both the value of the position and whether Zarmak is the right person for the job. Beyond the 61 from the 61,000 from the charitable foundation through January 1st, it will cost about $123,000. In-state money to maintain the office through 2015-2016 budget cycle, including Wozmak's salary, benefits, and administrative cost. Most of the money is coming out of the Commission's $66.7 million budget. Wozmak has came under security in recent months over his level of outreach to doctors, police officers, and others in front line of the crisis. If the vote is to have this position, he said, I would suggest we need a different person, said Cheryl Clott, the Business and Industry Associate Representative on the Commission and board member at Hope for New Hampshire Recovery. The Attorney General and Commissioner of Safety, Corrections, and Health and Human Services all said the position is critical to coordinate and fight against substance abuse across the state. This is really, really complex, and there are so many problems that aren't being addressed, Safety Commissioner John Bartholomew said. Given the position some more time, this position is not miracle worker. There's not going to be dramatic change over this short period of time. Collette was the only commissioner member to vote against maintaining that position, but several other members said the governor's office should access whether Wozmak is filling the role appropriately. Pam Walsh, Hassan's chief of staff, defended Wozmak's position is his plan to host a conference on prescription drug practice for doctors in November. His outreach is providing and his help in drafting legislation around substance abuse. Wozniak, who was not present for the Commission's discussion, also said he's working on developing preventing programs in schools and has met with more than 200 people involved in the prevention, treatment, and recovery effects. We've done a lot, he said. There is a lot more to do. This is a huge problem. Also Friday, the Commission voted to spend $1.4 million to develop community-based recovery centers and $125,000 for a pilot program in Keene aimed at helping people get the right substance abuse services before reaching a crisis. Southwestern Community Services runs a program that helps find resources for people at risk of homelessness, and organization submitted a proposal to the state to try something similar for substance abuse. And that does it for your special report. Good night, everyone. Bye.